Well, I was born in Yazoo City, Mississippi, a small town of about 17,000 people. I was born a twin. My twin sister Michelle was born perfectly healthy. Her twin brother Mike came out just a little bit ill. I was born with chronic asthma. It was awful. So bad that one day I got a severe asthma attack and I began to become comatose. And the story is told that I was about 5 years old, maybe 6, and my father picked me up and threw me over his shoulder and rushed me to the hospital that my grandfather built in 1924, the Afro-American Sons and Daughters Hospital. Back in those days, there was no ambulance service, no EMT service in the black neighborhood. There was nobody you could call, but there was no oxygen available. They tell me my extremities became blue and I stopped breathing. But there were some nurses and they joined around my bedside and held hands and prayed for me as if they were administering last rites. But my father rushed over to the white hospital called King's Daughters, which was about 3 blocks away, and begged them for an available canister of oxygen for his dying son. And they gave it to him. He rushed back to Afro-American Sons and Daughters and put me on that ventilator and hooked me up to oxygen, and I'm here today. When you look at that episode and then project it into modern days, I'm somebody who will be on the front line to make sure that we have Medicaid expansion in places like Mississippi without it. In fact, there was an African-American young woman in North Mississippi recently, last year, who had an asthma attack. And she was accustomed to going to the rural hospital about 6 miles away. That hospital had closed, and she died in 2019 of an asthma attack. A lot of these hospitals have closed because many of them in low-income areas where those folks cannot pay their medical bills, and because they can't pay their medical bills, they remain unpaid. So there's the issue of uncompensated care. And those rural hospitals have this vacuum of expense. I am just dedicated to coming up with a way to expand Medicaid in Mississippi. We need it. We should have had it a decade ago. And when I get to the U.S. Senate, I'm going to be the one to bring it here.